All right, patients with debilitating illnesses and pain have been waiting for Mississippi's medical marijuana regulations to go into effect, but it is a multi-step process.
And now the first licensed physician to prescribe medical marijuana in the Golden Triangle says part of his role is making sure the community understands how prescription cannabis works. Our Takia Cummings joins us in the studio with more. Takia.
There is a lot of regulation that comes with Mississippi's new medical marijuana law. And for one local physician, it means learning all that they could who benefits from this type of pain management. Education and experience, that's all it takes. And that's how we are here now. Dr. Jack Walters has been studying for this moment for years.
I think the important thing is just to try to educate people about what medicinal cannabis is and what medicinal cannabis isn't, and what it really means for our state going forward.
Walters works with patients and pain management every day at Columbus Orthopedic. Now he is the only doctor in the Golden Triangle approved by the state of Mississippi to certify cannabis patients. Each patient must have an ID card issued by the state health department. And in order to get that card, the patient must meet with doctors like Dr. Walters. He will examine patients to determine if he can be approved for the treatment. That's a lot of steps to make sure medical marijuana is highly regulated.
Well, I think when you look at Mississippi as far as in relation to other states across the country, this is something that has been well run in multiple states across the country, and I feel like our state is going to do a good job and try to get this treatment to patients who qualify to receive it.
Allegro Family Clinic President Amy Bogue says she doesn't hesitate to send a patient to Dr. Walters for guidance.
Our desire is to educate the public just what is medical cannabis and what's the process for it. And being a family practice, we wanted to collaborate with all other physicians in town and say, hey, we have a local expert. He has done a lot of studying and research and been talking to the state. And so it's really nice to have someone local that we can send to and send our patients to.
Dr. Walters emphasizes that medical marijuana should be an option if nothing else works. Bogue agrees.
And I like the word he uses as an alternative. If you've tried other methods and they don't work, then this can be an alternative. So you really need someone with his expertise, in my opinion, that's looking at the whole picture of the patient and can say, yes, this would be a good alternative, or no, it's not.
For a list of conditions that may qualify, you can go to the Mississippi Department of Health website.